Jeevi lost her baby in a life-threatening miscarriage. And after an agonizing week, she's already back working in the cotton fields. With a family to feed, she can't afford to stay away for long. Like many women in this remote village, Jeevi relied on the care of the traditional midwife.
I had really high fever and started bleeding heavily. I was 5 months pregnant. If I had better health care, my baby might have lived. But there's no point thinking about that now. What happened, happened. This is our fate.
Jeevi and millions of other Pakistani women are vulnerable to miscarriages and antenatal complications. Many still depend on unqualified and untrained midwives. Hundreds of maternal deaths are reported every year, and so far Pakistan has failed to meet its Millennium Development Goal to reduce the number of dying mothers. The basic health unit is the closest thing women in remote and rural areas have to any medical facility. This one is a half-hour's walk from Jeevi's village. But most of these units are poorly equipped and in many cases ineffective.
On average, we see 15 women a day, but sometimes we have to refer them to bigger hospitals. We don't have an operating theatre, we don't have an ultrasound machine. We don't even have an ambulance for emergencies.
The government claims that places like this provide 24/7 maternal health care and delivery services. But if you take a look at the delivery room over here, it's just the bare minimum. I mean, this bed doesn't seem like it's been washed for a while. There's actually a patch of dry blood. Some of these instruments are just not sterilized. It's quite hard to imagine how a small, ill-equipped room like this can provide any kind of services, let alone 24-hour delivery and maternal health care. Health charities say that Pakistan is the second worst country in South Asia to be a mother. It's a sad reality for women like Jeevi, who've suffered difficult and painful pregnancies and had to endure the distress of losing their babies. Shaimaa Khalil, BBC News, South Punjab.